Good morning, everyone. Once again, it's always lovely to see there's so many people here. And as I said a moment ago, please let us know where are you tuning in from and whether you are using this brand, the PODOPHARM brand, between your practices as well. And today's webinar is something completely new to us, as I just said, as we will be focusing on the food care and podology related concerns, or chiropodies as we would call it here in UK. And more specifically, we will be talking about fungal prone skin and fungal infections and compromised nail conditions, all based around PODOPHARM products and treatment approaches. And of course, all the products we will be discussing today are available through the Clamanti Salon Supplies website. Actually, we had a fresh delivery, arrived yesterday, and everything is available on the website. But honestly, these products are disappearing very quickly already, so I would definitely recommend ordering them rather sooner than later if you are interested in trying them after today's webinar. And we already see that this line is creating a lot of excitement within the industry, and it's definitely for the good reason. All right, I can see more people joining us, so I think we can start with the presentation. And as you said, we're going to be talking about the newest line of the PODOPHARM products. And personally, I will be using the name of the line Mykogen, as the producer says. But although, of course, you can pronounce it however it feels more natural to you. And this is the newest innovative PODOPHARM line, which was created with a holistic approach in mind for fungal prone skin, fungal infection, and compromised nails. And today we are going to explore exactly what makes this line so unique, what it has received and why it has already received recognition and industry awards, despite only launching towards the end of April, which is super impressive already. During this webinar, we will talk about fungal problems affecting the nails and skin. While the skin and nails can become more vulnerable to fungal infections in the first place, then fungal infections within pedicure, podology, chiropody practice. And then we will talk about the PODOPHARM's innovative therapy approach. Then obviously we will talk you through the professional treatment protocol, and then products themselves and their active ingredients, so you can see the science behind them and why those formulations are so unique and innovative. And of course, we will also talk about home skincare recommendation for clients and patients as well, because as we all know, successful therapy is always teamwork between professional and the client. Right, so that's our agenda. And of course, pedicure season has officially started. It's now in a full swing, isn't it? And I'm sure many of you have already noticed a huge increase in pedicures and foot care appointments recently. But I always say to my own clients that foot care should never be seasonal. Healthy feet are important all year round, not only during the summer months. And I always educate my clients about it, and I'm sure many of you educate your clients about this as well. And in today's webinar, we will be focusing mainly on what happens when a client comes to us, or patient comes to us, with a fungal prone skin, compromised nails, or fungal infection, and how we as professionals can support them with effective and long-term solution. Because our goal ultimately during the therapy is not only to temporarily improve the appearance, right? We want to restore healthy skin, healthy nails, and this long-term balance. And honestly, this is exactly the approach I personally follow within my own practice as well. And that's something I really learned and developed through working with PODOPHARM products and education. So before we properly begin, just a few organization points as usual. This webinar is being recorded. The webinar should last approximately around an hour, although if you know me already, you probably know that I can talk a lot. And if at some point I start going too deep into science behind the ingredients and formulations, because I genuinely love understanding how products actually work, please feel free to stop me in the chat box below. And I know we are here mainly today to discover the products themselves and how they support your treatments and practices. So I will try not to bore you too much with the scientific side of things, although I do personally find it very interesting. And everyone who registered for today's webinar, as there was a question in the chat box at the beginning, will receive an access to this recording afterwards via Clamanti Salon Supplies. You will receive an email and then you will be able to watch it via Clamanti Salon Supplies YouTube channel as usual. And due to the copyright restriction, the presentation itself cannot be shared directly with you, but please feel free to make your own notes during the webinar, and of course you will be able to revisit this recording afterwards as well. And we would really appreciate as well if you could share today's webinar on your social media stories with your colleagues or other professionals who may find this topic interesting, because by sharing educational webinars like this, you are also showing your clients, your future potential clients and your followers, that you continuously develop your knowledge, invest in professional education, and stay up to date with the latest industry innovation. I think is incredibly important nowadays, because our industry evolves so quickly all the time, and I truly believe it's also very beneficial to your professional image and your business as well. And of course, tag us in your stories. We absolutely love seeing your posts, your treatments, your results, and how you use PODOPHARM products within your own practices. And we would love to see your therapies and work as well. And now, before we really properly move into today's topic, let me quickly introduce myself, as some of you may be joining us for the very first time today. I probably should have done it at the very beginning, but here I am. My name is Joanna Bodarska, and I have been working as an independent beauty consultant with Clamanti Salon Supplies since 2018. And alongside that, I also run my two businesses, one consultancy business and one home-based beauty studio, Beauty by Joanna, and I have been working within the industry for nearly 2 decades now. And I have started working with PODOPHARM products from around 2019, I think, because that was the first when I purchased my very first product from the brand. And honestly, the rest is history. I love the product so much that I shortly after the pandemic, in early 2022, I started my proper podology education with Podo Education in Poland, which works very closely together with PODOPHARM. And since then, I have completed several theory and practical podology courses, and then I continue obviously regularly attending their webinars and educational sessions, because as I mentioned earlier, I truly believe that continuous education is incredibly important within our industry. Everything evolves so quickly, we get new technologies appear all the time, and I will tell you a little bit more about them right today during this webinar. Formulations are changing, treatments approaches are developing, and I think we should never stop learning, and we should be always up to date. And talking specifically about PODOPHARM, why you should choose PODOPHARM. So honestly, I think it's very rare to find a brand where the products consistently perform so well. They will deliver visible results, and generally they will support both you professionals and clients in achieving those long-term improvements, not just like quick solutions. And this is exactly why I love working with PODOPHARM within my own studio. And I don't think I will ever change this brand for anything else. And PODOPHARM itself is a Polish brand established in 2014, and all the formulations and production takes place in Poland. Of course, active ingredients are sourced from certified suppliers only all around the world. And I will actually show you a little map where are we sourcing our active ingredients from, because it's very interesting to see where all these ingredients are coming from. And over the years, PODOPHARM has built a very strong reputation, especially within the podology, chiropody, and food health practice. The brand has also received multiple international awards and continues expanding into more and more countries worldwide. And I think recently they expanded into Greece and Serbia. And honestly, it's amazing to watch how quickly the brand continues growing internationally. And what's very interesting is recently I had a lady from Romania, and I was like, oh, I'm working on PODOPHARM products. Oh, I know, my lady back home works with them as well. I was like, okay, lovely. So you already know about this brand. So it's amazing how the word spreads internationally. And this is why exactly I am so excited to share this newest innovation from PODOPHARM with all of you today. Because what I love about PODOPHARM the most is that the brand actually combines innovation with a very holistic, conscious, and science-based approach to treatment. So everything is backed up by science and research. There are no random products within the range. Every single formulation has been created using carefully selected active ingredients and naturally derived substances sourced from only certified suppliers. And everything is supported by research, as I said, studies, and real therapeutic practice. And today, when I show you the treatment examples, the before and after results, you will notice that there are not only just one or two selected photographs. You will see multiple examples from different professionals, different treatment settings, and different nail skin and skin concerns. So you can genuinely see how these products perform in real life in the professional settings. And I think you will truly feel that this brand was created by professionals who understand the needs of both us, practitioners, and clients, and they really listen to the feedback from the industry when creating new products and treatment solution. And since I introduced PODOPHARM into my own practice, most of my clients are using PODOPHARM now for their food care and switch to this brand. And if you follow my social media, which I obviously would invite you to, you see me using these products regularly on my social media, on my YouTube channel, and I use them myself too. So this is definitely the brand I genuinely trust both professionally and personally. And now let me move further into today's main topic, because as I said, I could talk. And what makes Mykogen line so unique itself? Because I know I give you a very long introduction already. So actually what makes this brand so different and so unique and so innovative is that the range is built around what PODOPHARM describes as a holistic approach to fungal therapy. And this is something I personally find incredibly interesting, because instead of focusing only on the visible infection of the nail plate or skin, this approach encourages us to look deeper and think about the body as a whole. Because very often when we see what we see on the nail plate, on the nail bed, is actually only a symptom of something happening internally within the body. So rather than treating fungal infection purely as a local contact infection, this approach also considers the possibility of systematic imbalance within the body. And this is where we start to begin thinking not only about the nail itself, but also about immunity, lifestyle, overall health, gut health, microbiome balance, microbiome, a very important word for today, and the condition of the skin barrier. Because as professionals, we know that if we only focus on the visible symptoms without supporting the deeper causes, very often the problem simply returns sooner or later. And this is exactly why Mykogen line is so interesting, because it combines professional treatment, then home care, prevention, microbiome support, and skin barrier regeneration into one complete therapeutic approach. So Mykogen itself consists of three key products, which together create three pillars of the PODOPHARM antifungal therapy approach. And throughout this webinar, we are going to take a much closer look at those products, their active ingredients, and of course, both professional and home care recommendations as well. But before we move directly into the products themselves, I think it's very important to properly understand why the microbiome plays such a huge role when we talk about fungal-prone skin, nail conditions, and those reoccurring infections. Because very often when we see repeated fungal problems, it tells us the natural protective barrier of the skin is not longer functioning as effectively as it should. So it's in very simple words, something is out of balance, so that infection keeps coming back. And when the microbiome is balanced, and this is our this protective shield, and all the microorganisms which are living in the skin, those bacteria, fungi, viruses, and other microscopic organisms, they exist together in harmony. And this is completely normal. In fact, we actually need them as a part of our natural defense system. And we all know that they help our skin, to protect the skin, support the skin barrier. They take much so it makes it much more difficult for harmful pathogens to take over. But the moment this balance becomes disturbed, we move into what we call dysbiosis of microbiome. And dysbiosis simply means that one group of the microorganisms starts to dominate and overgrow. So naturally, the next question becomes, what can actually disturb this microbiome? And here are many factors such as antibiotics, certain medications, stress, lower immunity, alcohol, poor diet, like that lack of fiber, excessive sugar intake, occlusive footwear or safety shoes. I'm sure you're very familiar with those. And poor hygiene habits, for example. Some people are not educated how to take a proper hygiene of their feet, a repeated trauma to the nail, like when we are wearing very uncomfortable shoes for a very long time. And then even treatments or products can disturb that natural skin barrier. And when we talk about the microbiome, many people straight away think about gut microbiome. And yes, that is extremely important. Very often we even call our gut the second brain. But for us, chiropodists, podologists, food health practitioners, and beauty professionals, the microbiome of the skin is just as important, especially when we think about feet today, nail plate, nail folds, nail bed, because these are the exact areas we work with every single day during consultations and treatments between the podology and chiropody practice. And another important part of the entire protective system is the pH, skin's pH. So alongside the microbiome, we also need to think about maintaining the correct pH balance of the skin. Healthy skin should naturally remain slightly acidic, usually around 4.5 to 5.5, and this acidic environment helps the skin while we are also supporting a healthy and balanced microbiome. So they all work together to create that protective shield. So they are creating this natural defense system against pathogens, right? But when the skin becomes more alkaline, again, when the balance becomes disturbed, the skin becomes much more vulnerable to the infection. And this is why when we see fungal infections, bacterial overgrowth, or conditions such as Pseudomonas infections, we also need to think about pH disturbance and restoring that correct environment of the skin. Because once again, it's not only about what we see on the surface, it's about understanding why the skin and nail became vulnerable in the first place. And this is exactly why holistic approach makes so much sense, because even if someone comes into contact with a certain pathogen or fungal organism, a healthy microbiome and strong immune system will naturally provide much better protection and make it much more difficult for the pathogens to penetrate and develop the infection. So ultimately, our goal is not only to temporarily remove the infection, our aim is to create an environment where healthy skin and healthy nail can function properly again for the long term. And this brings us to something I personally always talk about during my consultations and here during the webinars: consultation, because consultation is one of the most important parts of every successful therapy. And I'm sure many of you carry out very thorough consultations between your own clinics and practices, because we as professionals, we need to understand the full picture before we can even start treatment. We need to know that the therapy is properly tailored to that specific client and that specific case. And during consultation, of course, we ask questions like questions about their diet, lifestyle, immunity, medications, previous illnesses, footwear, daily habits, work environment, excessive sweating, sport activities, and many other factors that they may influence the skin barrier and microbiome. Because ultimately, the better we understand the possible cause, the better we can support the client and personalize the therapy for them. And what I think also is incredible, is incredibly important, is educating our clients properly, not only about products, but also about proper food hygiene, which I already mentioned, shoe hygiene. You wouldn't believe how many of my clients, they don't know that they have to disinfect their shoes, for example, or how and when to use home care products, why consistency matters, and why maintaining healthy microbiome and pH balance is so important in preventing that reoccurrence. And this is exactly why I really wanted to begin this webinar by talking about microbiome and pH first, because I'm sure you know about all of that, I know, but it's great to refresh that knowledge, so then we can pass it to our clients when we educate them. Because later, when we start discussing the products as well and the treatment protocols, you will notice how strongly this entire therapy approach is connected to supporting that microbiome, maintaining acidic pH, and rebuilding that healthy skin conditions. And once we understand those mechanisms ourselves, then it's much easier to explain them to our clients and explain to them the therapy approach and how we can achieve those long-term results. And this is exactly why when we are starting to think microbiome, skin pH, lifestyle, and clients education, we begin to understand why PODOPHARM decided to take such a holistic approach to antifungal therapy. Because if we think about many traditional antifungal treatments, right, which are already available for the market for very many years, we often see that they mainly focus on one thing: eliminating pathogens as quick as possible. And of course, reducing fungal infection is extremely important during the therapy, but what happens afterwards? How many times have you seen clients or patients where the infection improved for a while and then they are returning again a few months later with another infection? Probably quite often, because honestly, I definitely have seen them in many times in my practice as well. And it's so disappointing because we have to start everything all over again. And this is exactly where the Mykogen approach becomes very different, because the Mykogen line is not only focusing on eliminating the active vegetative forms of fungi, we are also thinking about fungal spores, those dormant survival forms of fungi that can remain hidden, usually in much deeper between the nail bed, so surrounding tissues or even inside of our footwear. That's why the hygiene of our footwear is so important as well. And that's why it's very important, because fungal spores are often one of the main reasons why these infections keep returning. And this is also why exactly shoes and eliminating those spores is so important. And we will talk about it today as well. So overall, all these elements really matter when we want to achieve long-term and successful therapy results. So, as I mentioned already, so this is the map of the ingredients where we are sourcing ingredients from, as you can tell, all over the world. But obviously the production itself, it's happening in Poland. And as I mentioned again at the beginning, the Mykogen therapy is built around three main pillars. And of course, the first pillar is elimination of pathogens, right? The second pillar is targeting fungal spores and helping to prevent reoccurrence of infection. And then the third pillar is regeneration and rebuilding, that correct environment for healthy skin and healthy nails. So again, restoring microbiome balance, supporting the skin barrier, maintaining slightly acidic pH, and creating conditions where fungal organisms or pathogens no longer have that environment that supports their development. And this is exactly why it makes the Mykogen line so what makes Mykogen line so innovative, effective, and very different from many traditional antifungal therapies currently available on the market. Right. So now let's finally move on to the first and probably one of the most important professional products within the line, the Mykogen ProCaps ampules. So let's talk about those ampules first a little bit deeper. So those are professional treatment ampules. They are to be used only at the professional settings, and every packaging you will find 3 different ampules like so, and each of the ampules, I'm gonna show you today like this, each ampule is 5 milliliters of product. And I know at the first glance they might look quite small, especially considering this is a very advanced professional product, but honestly these ampules are incredibly concentrated and extremely efficient. So one single 5 milliliter ampule should last you for approximately 150 nail applications. Right? So we are using tiny amount. We are working with these products because this product is super, when we're working with this product, as these products are super concentrated. And another very important point is that once you open the ampule, thanks to its specially designed glass packaging and protective cap system, the formulation maintains its full potency and effectiveness up to 4 months after opening. And of course, after those 4 months, the product doesn't not suddenly stop working overnight. It will simply begin to slowly lose some of the maximum potency over time, but it will be still working. And considering that the ampule can cover 150 nails, one vial, it is still incredibly efficient and professional formulation. And remember, this product is strictly designed for professional use between the clinic and salon settings. And between the therapy protocol, we usually apply this ampule during the professional treatments every 4 weeks, because ideally during the antifungal therapy, we would want to regularly monitor the client, assess this nail growth, check progress, and adjust recommendations when needed. So we would like to see this client or patient every 4 weeks. And what makes this again, this formulation super unique itself, that the formulation was submitted for European patent protection in December 2025, because currently no other antifungal therapy on the market uses this exact combination of components and formulation technology in this way. And one of the most important differences here is that formulation does not contain alcohol, and that was a very intentional decision from PODOPHARM, because as we mentioned earlier, we don't want to eliminate only eliminate infection. We also want to regenerate and support nail bed and surrounding tissues. So again, that holistic approach. And alcohol can be drying and irritating, and especially when you're applying it on the compromised nail beds, right? So instead of traumatizing or over drying the tissue, the goal here is to work efficiently but gently without causing unnecessary irritation or damage. And despite being alcohol free, this formulation still provides a prolonged time release effect, thanks to that carefully selected blend of active ingredients working together in synergy. And another very important thing is that the formulation does not require neutralization. It just shows how delicate it is for the skin. And we are working effectively, but very controlled and in non-aggressive way. And the active ingredient inside these ampoules are also very interesting, because this is where the formulation becomes very innovative. So first and foremost, this formulation contains encapsulated salicylic acid and which provides that keratolytic activity. And so basically, that encapsulated salicylic acid helps to gently loosen and exfoliate that thickened keratinized structures between the nail plate. And thanks to this encapsulated technology, the acid works in much more controlled, gradual, and slow release way without that aggressive damage of the surrounding tissues, right? So it has a chance to go much deeper into nail plate, removing those spore forms, fungi spores, which we're talking about. So we don't want that infection to come back. And because when we can work much deeper, we can work much more effectively. But still, in the same time, we are protecting the nail bed and those surrounding structures. And this also gives us much more better chance to, as was said, like get to those fungal spores and give those and get rid of them. Then we also have here lamellar azelaic acid, which provides very strong anti-inflammatory properties. And if you have attended my skincare webinars before, you probably already know how much I personally love lamellar technology because of how effective and gentle it works between the skin. And between this formulation, we also have, and not very often, or if ever, you can see lamellar forms of acids in the podology or chiropody products. Let me know if you heard about some of like lamellar technology used in any other products. But between this formulation, we also have pyruvic acid and lactic acid. So obviously they will, again, support that gentle keratolytic activity while maintaining this acidic pH environment, which is very important to get the right outcome of the therapy, right? And then when we, as we discussed earlier, it's incredibly important because the environment has to be acidic. So because obviously fungal organisms, they will thrive much more easily between alkaline environments. So we are working on restoring. So all the time during the therapy, we are working on keeping and restoring and maintaining those conditions that are much more, much less favorable for pathogenic growth. We also have here rosemary leaf extract and rosemary acid between the formulation, which will help inhibit the growth and proliferation of pathogenic microorganisms. Then another extremely interesting active ingredient between this formulation is the undecilic acid derivative. And this is the ingredient very well known for its strong antifungal and antibacterial properties. So again, we are not only focusing on fungal organisms themselves, but also we are supporting the entire microbiological balance on the skin and nail. And then we also have DMI between the formulation, which is a very innovative penetration enhancer. And this ingredient plays an extreme role because it helps to loosen the compact structures between the nails. So then this encapsulated acid treatment, this encapsulated salicylic acid or azelaic acid, they will have this lamellar form. They will have a chance to penetrate much deeper into the nail bed and surrounding tissues. And it's incredibly important because, as we already mentioned, we are not only targeting the active forms of fungi on the surface, we want to also reach those dormant fungal spores hidden deeper between the nail bed. And this is exactly where this technology becomes so interesting and effective. Then we also have bioactive gold water and bioactive silver water between the formulations. So bioactive gold water supports that regeneration process and deeper tissue recovery, while the bioactive silver water helps to create that optimal conditions for successful therapy and supports a healthy environment with and around the nail. So again, every ingredient here has been selected very intentionally, and each supports a different part of the therapy process. And yes, ampule, once again, can last you one ampule, can last one little bottle, can last you up to 150 nail application. And this formulation is super concentrated and efficient in the professional practice, and you will see some results in a moment. So when we look at how this product works overall, thanks to this, sorry, I forgot to, so this is the packaging. I forgot to move the presentation because I got too invested in talking to you. So this is the packaging. What's good about the packaging is that inside of the packaging you will find a leaflet, and then you will have a whole professional protocol, home care protocol, all the main active ingredients, how to use them in many different languages. So it's amazingly helpful for us at the practice. So we don't have to really remember it all, because I know it might be a lot and we have loads of different products and different therapies. So it's always great to have a leaflet like this. So in overall, what this Mykogen Pro Caps, how it works. So it provides that keratolytic activity, anti-inflammatory support, elimination of pathogens, and supports that regeneration at the same times. So it's not only designed for fungal infections as well. It can also support cases involving a bacterial infection or infections or mixed infections affecting both nail plate and nail bed. So it's a very good versatile product. Then it has also ability to break that biofilm. So biofilm is basically a protective layer created by pathogenic microorganisms, and which helps these microorganisms to survive and make them super hard to get rid of and remove. But by disturbing this biofilm structure, those active ingredients can work much more effectively and penetrate deeper into the affected area. And then this formulation also inhibits the growth of and proliferation of disease-causing microorganism, while again we are maintaining in the same time this acidic pH environment, and we also when we are also maintaining this acidic environment, it's key to keep us to keep the microbiome balanced and create that conditions that are less favorable for the fungal development. So overall, this ampoule works in very effective keratolytic and antimicrobial way and deeply supports regeneration and rebuilding of the nail bed. And this is why this formulation is so interesting and so innovative, because it targets infection from different points and then different angles, supports regenerations, restores balance, protects the nail for the long term. Okay, and now we are here, and obviously we are still addressing those three pillars of holistic antifungal therapy approach. So now we are moving on to another product, which is on its way to me exactly as we speak. So this is the product which is designed mainly like for the home use, because our clients and patients between the professional appointments. And this is the Mykogen Gold bioenzymatic exfoliating butter. I think this product is going to become a favorite of many clients very quickly. And yes, gold in the name, it comes from the bioactive gold water between the formulation. And we were talking about it because it's also included in the Pro caps. So it supports that regeneration process and help to create that optimal conditions for rebuilding the nail and nail bed and surrounding skin. And if some of you already, if you already are working with PODOPHARM products, as you will, you see that the packaging is the same as with the Onogen cream, which is an amazing cream, a bestseller, especially for the nails with onycholysis. So many professionals are already working with this product probably, and you recognize this type of packaging because it's super, it's gonna be the same. It will have a super nice and easy applicator for the client to use at home. We obviously are educating our client how to apply it, and it's very important when you are starting Mykogen therapy, you are using all the products because they work in synergy. You can't just choose one product. We are using all of them as one therapy. So your client going home with this butter and then a cleansing a cleanser. But I will talk about it in a moment, because as we said earlier, that therapy is not what happens, not only about what happens during the appointment in the clinic, but the real success comes when from the continuous support and consistency between the visits. And this butter is designed exactly for this purpose. This is Onogen, sorry, it's just the packaging the same. And the formulation of the butter has the pH of approximately 3.5. So again, we are continuously supporting this acidic environment around the nail and skin. And clients apply the product in the evening as a part of their home care routine. And while we see them professionally every 4 weeks, this product continues to support the therapy every single day between the professional appointments. And once again, between the formulation, you will find that encapsulated salicylic acid, lamellar azelaic acid, which will continue to which will be gently, which will have a gentle keratolytic activity, microbiome balance, and regeneration. We also have mild AHAs and PHAs acid, which provide that gentle physiological exfoliation without causing unnecessary irritation. And another incredible ingredient is Centella asiatica, also known as Sisa or Sika, and is an amazing ingredient when it comes to supporting regeneration, calming inflammation, rebuilding the skin barrier, and it plays a massive role in restoring that microbiome balance. Then we also have ectoin, which is a very powerful soothing and protective ingredient. And many of you may already know ectoin from dermatological or barrier repair therapies because it's used often used in products designed for very sensitive, compromised, inflammatory skin conditions such as psoriasis or any other dermatosis in the skin. And then, of course, between that formulation, we have several nourishing oils, which helps to support lipid barrier, comfort and regeneration. And again, we also have this bioactive gold water supporting that regeneration throughout the therapy. So overall, this butter will work almost as an extension. So those were like active ingredients, and this butter will will work as an extension for our professional treatments at home. It's like our little assistant working for us between the appointments, as it gently supports that physiological exfoliation, right? Helps to slow down the proliferation of fungal organisms, supports pH, and continuously creates that environment for which pathogens just don't grow, that they don't like it and they do not grow there. So while the professional ampules work deeply within the clinic setting, this product helps to maintain and continue this therapy for you every single day at home. And again, we are still addressing those 3 pillars of the holistic approach to treating fungal regeneration. Okay, and then the third product in our Between the Line Mykogen line is the Mykogen pH rebalancing cleanser, and I think this product is such an important part of the therapy because cleansing itself can either support or completely disturb the skin barrier and microbiome. And this cleanser was created to work very gently and very physiologically between the skin. So first of all, the cleansing base itself does not contain SLS or SLS. This is extremely important because we don't want to anything aggressive cleansing agents which will be stripping the skin barrier or disturbing the microbiome even further. Instead, the cleansing base here is, for example, derived from coconut, and it provides a much more gentle and more skin-friendly cleansing action. And the formulation also includes multiple botanical extracts and soothing ingredients, and for example, one of the interesting ingredients here is lavender oil. And this lavender oil is sourced from Bulgaria because this specific type of lavender has one of the lowest allergic potentials while still maintaining strong soothing and regenerating properties. So it's not just any lavender oil, it's a very specific lavender oil. Cleanser smells amazing, beautifully, like very calming, delicate lavender scent, which makes the whole therapy much more comfortable and pleasant for the client. And overall, how it works, it will gently exfoliate the epidermis, it will support natural epidermal renewal, it will strengthen the protective barrier, soothe that micro damage which we have, they will support lipid production between the epidermis, so we're talking about that skin barrier, and then again, it will restore correct acidic pH of the skin as it says on the packaging. So we are clearly focusing on microbiome, pH, and regeneration and rebuilding healthy skin condition. And I really appreciate that all the products work in the synergy. And when PODOPHARM is putting some like names on the packaging, they do not make random marketing claims. If the packaging says pH rebalancing, there is an actual research behind it. And dermatological studies, is that the next one? Yeah. So obviously, PODOPHARM has done dermatological studies where they were performed both on women and men, which is why you may notice slightly different values shown between the results, because naturally male and female skin pH differs slightly, right? And the studies demonstrated a significant reduction and improvement in pH balance, as you can see on the table here, even after relatively short periods of use. So again, these are not empty marketing slogans. The formulations are genuinely supported by research, testing, and therapeutic practice. And this is one of the reasons why professionals trust this brand so much. Again, this is one of 3 products within the Mykogen line. And now I hope you are still with me there. And now we can move to the actual procedure, a protocol in the clinic. PODOPHARM likes to keep things very straightforward. We don't use any unnecessary products here. We keep it straightforward and easy for us and then for clients to use at home as well. And this is the procedure and how we use this line step by step within the clinic setting. So the protocol itself, it's a professional procedure, so it obviously will be slightly different than home skincare routine because clients can't use some of the products at home. And this approach works beautifully together as a complete system. So first of all, we begin treatment by cleansing the feet using the Mykogen pH rebalancing cleanser. And this step is not only about cleansing the skin itself. It is also a perfect opportunity for you to educate the clients or patients and physically show them how to properly wash and care for their feet at home. Because very often, I don't know about you, but my clients think that they are cleansing their feet correctly, but in reality, they may completely skip areas such as between the toes, or they may not dry the feet properly afterwards. And as we know, excessive moisture left between the toes creates the perfect environment for fungal growth. So this first step already becomes part of the education process. And we really do not need to use large amount of this cleanser at all. Those are professional products. We use around 3 small drops, and this is completely enough, believe me. We gently work the product into like a light foam on the skin, leave it for approximately 1 minute, and then we remove it in using damp wipes. Like I would recommend the water-based wipes, like water wipes, which have physiological pH around 5.5, because we have to think about this pH all the time. And afterward, we dry the feet throughout using this disposable paper towel, for example, or whichever disposable units you use at your settings. And proper drying here is extremely important, and we have to obviously educate our clients as well. And then we are moving to the preparation and cleansing of the nail itself. And at this stage, we carefully remove all the touched, thickened, and infected fragments of the nail plate, obviously where needed. And of course, I know you already know this very well, but I will repeat it. It's always important to remember that we work extremely delicately around the nail bed. We never work aggressively with a drill directly on the nail bed itself. I know you know that, but I thought I will maybe emphasize on this once again, because the goal is not to traumatize the tissue. We always want to work physiologically and respectfully with the structures we are treating. So cleansing around the nail bed or the nail plate, we can use instruments such as probe, curette, podology spatula, depending on what is your preferred technique, and obviously on the condition of the nail. And again, we are working very, very gently and precisely here. And once the nail is properly prepared, we then spray the area with Muco Booster spray, this one. And this product is generally used here within this therapy only during the first professional appointment, and afterwards we usually recommend it to the client as a part of their home skincare routine for the footwear disinfection, because as we discussed earlier, fungal spores can survive not only between the nail but also inside shoes, and clients like which they are using on daily basis. And if we would ignore it, it becomes part of like reinfection, and that infection can come back. And after applying a muco booster, we move on to my personal product. It is this PODOPHARM Skin and Nail Softening Prebiotic Spray. I'm sure you know this product as well. We have it in two different sizes, and you might know it very well already. So this spray creates a very delicate foam consistency once you spread it on the skin. I will maybe show you like this, a very gentle, nice and stable foam here. It's very often some of my colleagues like chiropodists, they are using it to finish off the treatment because it gives you a beautiful effect, and the foot is not gonna slide, like let's say if they came in sandals or flip-flops. So you can use it this way as well. And we apply it on the skin, leave it for about 30 seconds or to 1 minute, depending on the condition of the tissue. And here we are not working, and if we are not working only with the nail itself, but also on the entire foot, this product beautifully softens any hyperkeratosis, dry skin, callus, and thickened epidermis around the heels, soles of the feet. Love, love, love this product. And it makes the preparation stage much easier and much more comfortable, both for us and for clients. And thanks to its prebiotic support between the formulation, we are also continuously supporting that microbiome and protective barrier of the skin. And once everything is beautifully prepared and the nail plate is dry, we move on to the Mykogen Pro capsule. Where are they? Oh, sorry, I left them here. So we have a capsule, we open the capsule, and then we work here only on a very like properly dried nail plate, and we are using here micro applicators and I'm sure you all have them at your beauty settings and or clinical settings, and obviously one applicator per one nail, but that's besides the obvious. And we are applying a very small amount of the formulation onto the affected areas of the nail and spread it evenly across the surface and around the affected structures. And because this formulation is so concentrated, once again, we need only a tiny amount of the product. And after application, we secure the treated area with a gauze pad and leave it in place on client's skin for approximately 12 to 24 hours. But from what I spoke with some people who already use these products, they ask their patients to leave it for 24 hours. And then we will be educating them what to do at home. And I know when I told you to leave it underneath the gauze for 24 hours, many of you probably think, but this is an acidic formulation, won't it irritate the skin? And no, it's not going to irritate the skin. We have obviously research. We've done, PODOPHARM done its research. The formulation has been specifically designed to work effectively while remaining very controlled and non-aggressive. We also have clinical testing and research confirming its safety profile. So again, we are working deeply and effectively, but without traumatizing that nail bed or surrounding tissues. And then where this therapy truly begins. And now we are moving to the client's at-home protocol. So in between the treatments. So this is where consistency becomes incredibly important for achieving long-term results. So whenever I start working with my clients, I always tell them, we're gonna either work together or we're not gonna achieve good results, because this step is absolutely crucial. for achieving those long-term results. Because depending on the type of infection we are dealing with, the home care is different. Sometimes we have more stages, sometimes less, but clients have to do it at home. If not only you will see that they haven't been following the procedure on the next appointment, but the therapy is not gonna progress as it should. Obviously the at-home procedure is slightly different depending on what type of fungal infection we are working with. But first of all, the client is at home, is using that Mykogen pH rebalancing cleanser every day throughout the whole duration of the therapy. And this is very important, as we discussed earlier, because we want to support that microbiome and maintain that correct acidic pH environment. So in the evening, let's say, client comes home, they washes their feet properly with the cleanser, exactly the way we showed them during the appointment, making sure they cleanse carefully between the toes and dry the feet thoroughly, properly afterwards. And then onto the affected nail bed, they apply that Mykogen Gold bioenzymatic exfoliating butter. And then, very important here, not too much product. So we have to show them how much, we have to educate them how much product, correct dosage, because the formulation again is highly concentrated and effective even in a very small amounts. And then very thin layer is completely enough. And the product should be spread evenly across the affected nail bed, nail and surrounding areas, and then left overnight. And then if we are that evening routine becomes very, very important. And now if the client struggles with excessive sweating, which often very often goes hand in hand with fungal infection, then we can additionally recommend products such as foot cream with silver ions. So they will be applying this cream in the evening, right? Beautiful supportive product for the clients with excessive sweatings, like where they're using those occlusive footwear for people who are very active when it comes to sport, or they have those recurrent fungal tendencies, like they have candida, for example, because that excessive moisture creates a much more favorable environment for the fungal growth. So we want to support sweat regulation and skin comfort during the therapy. Okay, so clients are going to bed, they sleep, they wake up in the morning, and they leave those products overnight. And then in the morning, they will repeat the cleansing again with the Mykogen pH rebalancing cleanser. And then afterwards, depending on the pathogen we are working in, we introduce the appropriate additional product. So for example, if we mainly dealing with dermatophytes, we are using the Myco Booster nail oil here, whereas in the cases where yeast, molds, or mixed infections are involved, we are using the mycostatic tincture. Oh, sorry, here. So this is gonna be this packaging. And this is a very important educational moment, because very often my clients think like, oh, I will put more products so I will get better results. And those are professional formulations. So we do not buff our toenails in this product. We use 1 or 2 drop per nail, and this is absolutely enough. This product spreads beautifully across the nail plate and nail bed. The formulation is just right to spread beautifully. So we have to educate our skin that our clients, that they are not supposed to soak their nail in the product, because they are highly concentrated and they should last them for a very long time. So it might look small, but it's very mighty and powerful. And then once a week, we also ask our clients to disinfect their footwear using the Myco Booster spray. So they are spraying their foot, leaving it preferably over the night, and then they can keep using those their footwear as well. Because if you ignore that shoe hygiene, reinfection becomes more likely. As again, we want to have a long-term improvement. We want to prevent infection, and we want to keep those healthy, balanced feet through a very long time. And if they have excessive sweating, one more thing, during the day, they will be using antifungal foot spray, this one with the green line. Amazing product, very refreshing. My clients absolutely love this product, especially clients who spend long hours in closed shoes, work physically, go to the gym regularly, spend most of the day on their feet, safety shoes. They love this product because it keeps their feet very refreshed and comfortable. It gives them more comfortable feeling. So this overall, this becomes our client's home care between the appointments, and you will also have it listed here on that leaflet when you buy the Pro Cups. So it's very helpful to have this leaflet in hand. So again, long-term results, eliminate the infection, improve the skin for the nail for the very long time. And I always remember, I always explain to my clients that this is a teamwork, because we guide them professionally, we perform the treatments, we choose the protocols, but they also have to continue therapy properly at home. Because when because that's when we only can see those long-lasting effects and minimize the risk of reoccurrence of the fungal infection in the future. Okay, so now I think I already told you pretty much everything I wanted to share with you today about these products themselves, the treatment philosophy behind the Mykogen products, and both in cleaning and home care protocols. I hope I covered everything, and it was clear and easy to follow. And I know most of you already knew all those things from your practices, but I always think that it's good to refresh your knowledge. And what I love about the PODOPHARM protocols, they are quite step by step explained, and usually very straightforward and logical therapies to work with. And that is something which I really appreciate. And then I want to show you how effective are the products for the antifungal infections. So let me show you some examples. So we have cleansing here, and I will show you the examples as I promised you to begin with. And those are examples of products, because obviously PODOPHARM of course gave those Mykogen products to specialists to try it within their practices for 5 months or even longer, and you will see work of some of the top podologists, chiropodists, and forehead specialists in Poland and European countries, like for example Lithuania, for example, and those are genuine therapy results from professionals working daily with difficult fungal and nail-related cases. So here we can see the first case, Trichophyton rubrum. I guess this is one of the most popular type of fungal infection we can see here. Beautiful therapy. Obviously, we still have clamps there, but it takes time. We can see here 4 months progress, which if somebody would show me this before and told me like you can achieve this kind of results within 4 months, I don't know if I would believe, but this is the proof how beautifully it works. This line of products works. Then again, another one, Trichophyton rubrum, Paulina Rajska. She's one of the top podologists when it comes to dealing with a very difficult fungal infections. Then another one, again, Paulina Rajska, a beautiful effect as well. Of course, we are showing you effects after 3, 4 months, and those feet are still in a progress of healing and a progress in therapy. But we wanted to show you what we can achieve between 4 months therapy. Another one, Karolina Nowak, Trichopitum rubrum. This is probably what you see at your practice very often as well. And then psoriasis as well, we can hear. And then another one, psoriasis candida. Oh, sorry, I'm gonna go back. This is what I see a lot at my studio. Unfortunately, when people are coming after all those treatments done in some random places when the disinfection maybe is not followed, and then they haven't been changing their stylist, like the gel nails or shellacs adequately, like between 2 weeks or so. This is what can happen, unfortunately. Here as well, Lichen planus as well. It's very, this line of products is very good for this kind of therapies as well. Here we have the soles of the feet as well, Paulina Rajska. This is a very damaged nail plate, and you can see what kind of results we can get within 3 months. 3 months, incredible. I mean, these photos are for me, they really show how extremely advanced those therapies are. Another one, Candida species. I have it quite often as well, unfortunately. And then this one was a very difficult example of Paulina Rajska, but she found the solution to deal with it. And as you can tell, she managed to get these toenails to beautiful, beautiful stage. And then again, another one is like more other treatments. So you can see different fungal infections and how, like how big is spectrum of the efficiency between this Mykogen line therapy. And then another one. Here Trichopitum rubrum, again, Vitaly Konev. This is Paulina as well. Beautiful results. 3 months. I'm just saying 3 months. And again, another one. Sure, you see it very often at your practices as well. Here. Let me know in the chat box below what you think about those therapies, because I think it's amazing. Katarzyna Kłosińska, I very often come to her webinars, love how she is teaching us about proper treatments, protocols. And then another one as well, before and after, amazing results. And that's it. So now we are waiting for your works and for your therapies. Please, please share them with us. We would love to see how you approach your difficult cases. And now, if you have ever problem with a certain case, you came across a very difficult case, or you're not sure which products you should be using, either in the practice or at home, here is an email address, marketing@podopharm.pl, and then you have a team of specialists, amazing chiropodists, podologists, and food health practitioners who will be able to assist you between special, between creating that specific therapies, between choosing the right products. They are amazing. I very often consult with them as well, and they never leave any of my questions without answer. They are quite prompt as well with their answers and really, really helpful. So if you have any questions in regards to the therapies, please, please, please do not hesitate to contact them directly, and I'm sure they will be in touch with you. And once again, those products are now available at the Clamanti Salon Supplies. Thank you so much for staying with me for such a long time. I don't even know what time it is. And now I'm gonna look the into the chat box. But wait a second, I'm gonna see the chat box and see if there are any questions. But as I said, if you have any specific questions in regards to the specific therapies or cases, please contact marketing@podopharm.pl. Okay. Okay, so we have some messages here. Recording. Sylvia is asking if there will be recording. Yes, of course. Anna here from Luton. Hello. Hello all. On again is great. I know. Everyone, Sylvia is saying on again is great. I know. Like everyone is using on again, isn't it? It's such an amazing result. I have used it on myself and I had some amazing results as well. Melanie, good morning from Melanie. A lovely sunny day joining you near Bath. Bath, how amazing. Good morning from the rainy north. Oh, unfortunately, the rainy. We have some sun, so we're gonna send you some sun as well. And then Melanie is saying, I have been using PODOPHARM PODOFLEX UV-LED gel antifungal treatment on my patient with damaged toenails, reducing the nails and applying the gel every 4 weeks. Is this a good treatment for my patient fungal nail? Should I be applying the ProCaps treatment first? I have recently qualified as food health practitioner, although I have been a beauty therapist for over 45 years, and this area is very new to me. No problem. So before you start applying any gels, yes, the one from PODOPHARM, first of all, you have to deal with the infection. So this is your first port of call. So first of all, you buy the whole treatment series, like the whole line. You use it as it was in the protocol. Clients are using their home care, and then after you treat the fungal infection itself and it's fully recovered, then you can move into building those nails over and carrying on with like helping your clients to recover faster. But first of all, we have to deal with the infection. This is our first thing which we have to take care of. No gels, no nothing. First, dealing with the infection and pathogens. Thank you, Anna. Thank you for the wealth of knowledge. As always, reliable presentation. Thank you so much, Anna. Okay, I don't see any more questions here. I hope you found this webinar helpful and interesting. I know it took a few minutes for me to go through it, but I really wanted to show you why we are believing in this holistic approach when it comes to fungal infection, because it's super important, not only for us, but also for our clients to understand the reasoning behind it and why we are using these things in certain process, because this is not an overnight process. The therapy has to be done properly, and we have to work as a team with our clients. So I hope you found it interesting. I'm waiting for your photos before and after. I will be starting a few of those cases as well. I have some ladies here who will be working with me. And do you have any pedicure courses available? Not at the moment with Clementina Surprise, but we might be looking into that in the future, and if you obviously require within the PODOPHARM brand, we can think about it for a future when it comes to pedicure courses. And of course, let us know what you would like to see next or in our next webinar. Would you like maybe to talk about like, all the products from PODOPHARM, or would you like me to maybe show you an example of like more cosmetic, like beauty, like, spa pedicure, which you can do if you are not a food health professional, let's say, and you're looking for like more like a pedicure, a good pedicure, but a bit like on a higher level. So it can give more effects for your clients. Let us know. What would you like to see? And we will try to accommodate as well. I hope you will love PODOPHARM products as much as I do, because I truly appreciate their products and how they work and their effectiveness. And I am waiting for your stories, for your for your posts. Thank you so much. Thank you for your time. And I wish you all a beautiful, successful therapies and your own settings. And I will see you during our next webinar, because obviously we think we have some other webinars in line for you. So we will stay in touch. Thank you so much. And I will see you next time. Thank you. Bye bye. Have a nice day.